Attention! We interrupt your local scheduled program for the following announcement. If you or a loved one has been diagnosed with mitral valve stenosis, you may be entitled to physical therapy intervention. The mitral valve is like a gate that allows blood to flow from the left atrium to the left ventricle and prevents blood from returning from the left ventricle to the left atrium. Mitral valve stenosis occurs when the mitral valve becomes narrowed from fibrosis, scarring, or abnormal calcium deposits on the valve. This prevents the valve from fully opening, increasing the resistance the left atrium must pump against to move blood into the left ventricle. The increased resistance the left atrium must pump against causes it to hypertrophy. When the left atrium is overloaded over time, muscle dysfunction, congestive heart failure, and death may occur. Here is live footage from a real patient with mitral valve stenosis.
An individual with mitral valve stenosis might experience any of these signs or symptoms: dyspnea, fatigue, decreased cardiac output, and atrial fibrillation.
Paroxysmal nocturnal dyspnea, orthopnea, dizziness and fainting,
Cough with pink, frothy sputum or hemotesis,
dysphagia, and hoarseness. Mom, what do you want for dinner?
You're not taking my cat.
For dinner, Mom.
No, my cat is fine.
To eat for dinner.
My cat is fine.
If you or a loved one have any of the following risk factors, you are at a higher risk for mitral valve stenosis. Females, anyone with rheumatic fever, which causes inflammation of the heart, blood vessels, and joints, and can lead to rheumatic heart disease and rheumatic arthritis. Pregnancy, congenital heart disease, or a heart disease from birth. Age-related calcification, which causes your tissues to harden, or atherosclerosis, which is a buildup of plaque. Blood clots blocking the mitral valve, radiation exposure to the chest, hypertension or high blood pressure, hyperlipoproteinemia, which is excessive lipids or fats, diabetes mellitus, or living in an underdeveloped country. So how do these conditions cause mitral valve stenosis? Let's ask an expert.
Any of the risk factors previously mentioned can cause the mitral valve to thicken and narrow, resulting in a snapping sound when it opens and a murmur when it closes. The narrowness of the valve increases the pressure in the left atrium, causing it to contract with more force to maintain cardiac output. The greater contraction causes pathological hypertrophy due to increased demand on the myocardium. The increased pressure in the left atrium and decreased chamber size disrupts the pressure gradient between the left atrium and the left ventricle during diastole. This decreases the amount of blood that flows from the left atrium to the left ventricle because the narrowing of the mitral valve and the decreased volume of the left atrium due to hypertrophy causes less blood to flow to the left ventricle, even though pressure gradients generally drive shifts from an area of high pressure to low pressure. Increased left atrial pressure and a diminished cardiac output decrease the amount of blood the left side of the heart receives to pump out to the body. Hypoperfusion of the left side of the heart exacerbates mitral valve stenosis symptoms. Increased pressure experienced by the left atrium can also increase the pressure the right ventricle experiences. This can cause the pulmonary vasculature to constrict, possibly resulting in right-sided heart failure as well.
This disease is diagnosed through the use of ECGs, auscultation of carotid bruits, exercise stress tests, and cardiac catheterization. Treatments include pharmaceuticals like digoxin, beta blockers, antiarrhythmic agents, anticoagulants, and diuretics. Surgery, like a balloon valvotomy, CABG, or left or right ventricular assistive device, might also be recommended to repair or replace the damaged valve.
During physical therapy interventions, a physical therapist must understand that patients with mitral valve stenosis will fatigue easily due to their reduced cardiac output. Patients might also experience shortness of breath, dyspnea on exertion, limited activity tolerance, and limited functional capacity. Therefore, it is important for physical therapists to monitor a patient's vital signs like heart rate, respiratory rate, blood pressure, and oxygen saturation, as well as listening to a patient's heart and lungs to observe for any abnormal sounds. Physical therapists might also have to communicate with athletic patients who have symptomatic or severe mitral valve stenosis because competitive sports and strenuous activities could place more strain on their heart. Due to increased strain during exercise, Patients should train at an RPE level of 13 on the Borg 620 RPE scale to avoid overloading their cardiovascular system. Patients can also improve their condition by limiting their salt and fluid intake.
Mitral valve stenosis can go undetected until symptoms are present, so medical intervention is usually delayed. Please don't wait. Call your physician and physical therapist today.